don't know if it has to do with the band that they put around it, but it just feels rough.
Does it feel like you've got debris in the eye?
A little, like it just doesn't feel like my other eye, it's smooth. It feels
Yeah.
rough, I
Well,
try to go ahead.
it's drier also.
Mm,
So after a procedure like that, and with the medications that they give you, your eye's drying out. So we got to get more moisture back in the eye, so that you're not feeling the eyeball with your eyelids.
mm. Oh God. Yeah.
Yeah.
So
So
do you have like a website or an area where I can go and look at these products, the Luster, the Foreign Eye, and the 3070?
absolutely, absolutely. And what's going to happen is, oh my God. So we're going to DM you. Coco is going to DM you and tell you the products and give you the website, and then you'll be good to go.
Okay. I do try to use like a cool misting in the room to help me. I do it at work too. I mean, I bought all kinds of like, this is the first time I just bumped into you for the first time. So I don't know the history or haven't even had a chance to look at your like little bio or anything, but um I did do like special teas for circulation for the eye. And while I was in Savannah, it was just, I was like Instacarting like turmeric and listening to, and you're going to think this is crazy, but like eye frequency sounds that might help my
Yeah.
eye. And
Yeah, no, you look for every option.
hmm yeah, I
You
mean,
look for every option,
when I,
especially when
go
you're
ahead.
traveling, because you're like, whatever it is, I need it to be something I can get right now.
Yeah, it was rough, but they were very hospitable. They were great. The doctor, I was thankful. I must have been there for a reason. And when they connected me to a doctor here in Jersey, I'm from New Jersey, and the doctor is very nice. I'm thankful that he took my case because he didn't perform the surgery. But when I was showing him some of the things that I was taking, some of the like macular vitamins and I was trying to do anything that I could to help the beginning of my healing process, but he was just like, "Oh no, you just have to eat right." So he wasn't I don't think he was the right fit for me, but I can't really change him right now. So,
Right. Well, I think you definitely need to add lutein and zeaxanthin back into your eye, and that's part of the eye drop that I would, put you on.
I am
Um,
taking that orally right now.
okay.
But I didn't even know they had it in drops.
Well, not a lot of people do, but I do
Okay.
because I think it is so beneficial to the eye system. So, and DMSO, which is dimethyl sulfoxide, that penetrates very deeply. It's anti-inflammatory, and I also pair in castor oil. So castor oil is very restorative and regenerative in the eye system.
Mm,
So that's really going to help your eyes come back to themselves. It supports the health that your body wants to, put back in place anyway.
okay.
So what my eye drops do from a natural perspective is they support the natural healing that the body already is attempting to do.
Yeah, I feel like since it's been since July, I was just telling someone yesterday, I can see near, I can't see far. Everything is very, very blurry. I can make out shapes and I can see that it's a car, but like I can't read the license plate. These are things that I used to be able to do. I know some people
Right.
can't do that at all on the regular, but that wasn't my normal. So um, I'm hopeful that I maybe will get my vision back, but I can't drive at night anymore because I get these like huge starbursts of light in this eye.
Yeah, huge halos.
They're gigantic, and I can't. So that's so it just I was able to go back to work, although I wanted more time off because I wanted my eye to heal. But my
Yes.
doctor was, no, 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 you have to get back to your regular routine. And I'm like, but I can't see. I'm an executive assistant.
Yeah.
So I said to him, I'm on the computer, 8 hours a day. If I'm working, that's what I'm doing. I'm facing the light.
Right.
And he's like, no, no, you'll be fine, And he said, don't think that your left eye is going to get tired. He said, or worn out is what he said. It'll be fine. You just need to give it like 10-minute breaks. And I was like, oh, great. This,
Okay.
you know,
I'm like, golly, really? This is what doctors are doing?
yeah.
Um, I think you should actually patch your eye at night
Oh,
so that you don't have any light in that eye for a period of time and let it rest overnight. Even though your eyes are closed, light can still penetrate the thin skin that is our eyelids. And sometimes, we blink when we sleep, you roll over, stuff like that. I think it would be great if you start using my eye drops that you would patch the eye overnight.
okay.
So you're going to do an eye drop, you're going to put a patch on the eye, going to go to sleep. When you wake up in the morning, close both eyes, take the patch off the eye, let the light settle in, and then open your eyes. And then do your drops and then go about your day. Because what have you ever damaged that didn't need rest to heal?
Mm. And I'm having a hard time sleeping. So that was something that I had from before. And, one of someone that I had connected with who was an integrative ophthalmologist, but I was only able to see her virtually. She was like, if there's only one thing that you can do, she was like, you need to rest,
Yeah.
she said, which I'm not very good at, but
Well, you can rest your eye just by patching it.
okay.
You can put a patch on your eye and it will rest because if there's no light coming in, there's nothing for it to do.
Mm, I
So I
see.
recommend that people get organic cotton balls. You pull it apart a bit and you put that inside of a gauze pad and then you put that on your eye and, tape it down and leave that on.
Okay.
You can do that when you're watching TV or whatever else, but you want to rest that eye. I
Okay.
know it happened in July,
Mm-hmm.
and the scleral buckle is going to keep everything intact, but the eye is not going to have the ability to restore sight if it can't rest.
Mm,
So giving it that time is huge. Adding
okay.
moisture back into the eye system, that's also going to be huge. Having your other eye be as healthy as possible also, so you don't have the same situation occur.
Yeah.
And you've already been told that you've got a lattice issue, so there's degeneration already.
Yeah. The whole thing is very scary. Um,
Yeah.
in an instant, you lose your independence, like within seconds, once they tell you.
And
And once you have the surgery, and I see the eye doctor every year like clockwork. I had
right,
just seen the eye doctor in October. They said nothing to me about a lattice or anything, any sign other than that
right.
I had the beginnings of like cataracts, which
Okay.
which the doctor tells me now, the specialist, that my cataracts will probably be accelerated because of this surgery or this retina
Well,
detachment.
the eye drops I'm going to put you on will actually restore not only the health of the eye system, but will also um, dissolve the cataracts.
Wow.
So you're not going to have to manage that situation on top of all of this. Did you experience any onset of floaters?
When before the surgery,
No, after the surgery.
I did occasionally. Yeah, not often though. I did. It's been a couple of weeks. As a matter of fact, I called the doctor about 4 or 5 days ago because I was somewhere and then all of a sudden I saw this pinpointed floater and I was like, oh shoot, what is going on? And they were like, oh, if you see a floater, it's okay. I was kind of baffled by it, but I'm not a doctor, so I don't have a point of reference. But she's telling me, if you see a floater once in a while, it's okay. And I'm like, oh God.
Well, a floater once in a while is okay, but after your situation, a floater could mean that the